Welcome to the video on cultural diversity and healthcare. Today we'll talk about the cultural diversity and how does it impact the healthcare. Let me state about the American medical system, the goal thereof. The goal is to provide an optimal care to all the patients. Healthcare provider must understand cultural differences that creates conflict and misunderstanding that can result in inferior medical care. Caring for patients for different culture has been stated. So healthcare must understand the differences of culture that might create a misunderstanding, might create a conflict, which results in poorer medical administrations. So role of cultural competence. This is very important as far as healthcare is concerned. What is cultural competence? It is set of an academic and personal skill that allow us to increase our understanding and appreciation of the cultural differences between groups. We can be empathizing with the people about their points of view, their way of life, their living style, and so on and so forth. And that is what cultural competence is all about. It's a set of academic and personal skills that allows us to be empathetic and appreciate and understand the cultural difference between different kind of people. Question is, can we achieve cultural competence? And I believe strongly, yes, we can. For understanding culture, we need to understand acculturations, as in what is happening. Remember, separation is when individual values holding into their original culture and avoid interactions with other culture groups. They would love to think that their culture is the best one and they live in the silos, keeping every other cultures at a bay, at a distance. Then comes the marginalizations, low interest in cultural maintenance and relationship with individuals from other cultures, as in marginalism is all about it. In fact, they as separation which were working in isolation, but this is marginalization where they will be mixing up, but they will keep in their core of their heart as in their values, their lifestyle, their thought process is the way to go for it, and will take less interest on what other peoples are doing. Integration, cultural integration is maintained while the individual participates in the larger social network. That is what integration is all about it. And then we have got assimilation. Individuals from a non-dominant group does not wish to maintain their original cultural and actively participates in dominant culture where there is these people would like to assimilate into the dominant culture and prove one with them. So that is what the continuum of our culturalization is all about. It one is in isolation as in separation, then comes the marginalization, then probably give and take at the best of the features of the other cultures to be adopted, accepted, as all about integration, and then you're trying to identify yourself as with the dominant culture as an assimilation. So yes, this is the four stages of acculturation: separation, marginalization, integrations, and assimilation. So, if you look into it, how we have spoken about here, first is your cultural destructiveness. This is where it comes out. Every step goes one at a time, from the cultural destructiveness to cultural incapacity. Certain cultures, certain work things doesn't work, functions at all. Cultural blindness, as in without your culture, things every other cultures are not to be trusted upon. Cultural pre-competence, as in why not you try the water, test the water before you start accepting the goods and the bads of the other culture. Cultural competence, where you find which is doing good about your thought process, your cultures, your way of thinking, or that of the other people. And then comes the cultural proficiency. These are the various steps where you can accept cultures as the way to go around it, from cultural destructiveness to cultural incapacity, from cultural incapacity to cultural blindness, from cultural blindness to cultural pre-competence, from cultural pre-competence to cultural competence, from cultural competence to cultural proficiency thereby. So yes, we are talking about this cultural competence, which is all about being open, all about being flexible, all about being able to do so, and that is what we try to go around it. Remember, cultural domain is all about cultural awareness and knowledge. This is what we are talking about it. Effective domain is the sensitivity of the culture. How sensitive are you? Behavioral domain is the skills of the culture, cultural skills. Environmental domain is what the culture encounters as far as the environment is concerned. Now, how does the receiver-based variables are? Holistic nursing care quality of life improves. Healthcare satisfaction improves. Adherence to treatment. If you think everything improves, you remain adhered to the treatment. You follow the dictum that has been mandated. Provider-based variables. Now, this is what you need to not. The first one was the patient-based variable. Now, this is provider-based variable. Personal and professional growth and cognitive development of understanding. Next is the health outcome variables. This is where the quality of nursing performances would improve. Similarly, for treatment effectiveness becomes stronger, and it is all about cost effectiveness that we need to keep an eye upon it. Why cultural competence? The question remains ever now and then. Why is cultural competence so important? Remember, cross cultural misunderstanding may play a role in perpetuating healthcare disparities. Legislative policies, accrediting mandates for the inclusions of cultural competence in training in medical schools, in healthcare, as the case might be. That is what you need to keep in mind. So, why the concern? Because of the ethnic diversity that is increasing, ever increasing day by day, and it might. I have you need to understand this in every perspective. Healthcare inequities experienced by the non-white Americans and so on and so forth. I'm talking about the black Americans. I'm talking about the brown Americans. I'm talking about anything Caucasian males. You name it, and we'll have it everywhere. Now, this is what we need to understand. Current health care provider trained in a less cultural diverse environment may be less prepared to deal with diversity. This is what we need to go around it, and people are not very sensitive to cultural diversity as of today. They may also be likely to offer valuable therapies to certain patients. Over 600 disparities documented in the Institute of Medicine report, as the case might be. That is what should be followed altogether. Cultural competence, fundamental elements, understand the dynamics of differences, implement policies and procedures, value diversity, perform a cultural assessment, question self desire and motivation for positive changes thereby. And how do you go across with it? So this is what we look forward to. Understand the value of dynamics for differences. This is what we should be adhering to. The dynamics of differences among patients, among providers. Avoid cultural blindness. Believe that the culture or the color makes no differences. All people are same. Differences in quality of care, as the case might be. So yes, there are differences among patients, among providers. These are these differences needs to be avoided. The blindness, cultural blindnesses, as in belief of colors, cultures make no difference. All people are same. Difference in quality of care, that is important. So incorporating cultural competence with healthcare system, cultural engagement, cultural perspective, reciprocal transfer of knowledge and skills. Healthcare organization is all about consensus statement, call for action, accreditation, develop competence and curriculum thereby, and that is what we need to go across with it. Value diversity. Lack of diversity in leadership, improve early education, recruitment and retention, mentoring, workforce diversity, different perspective, improve communication, comfortable environment per se. Now, these are my valuing of diversity as in the in diversity in leadership, as in improving early education, recruitment, retention, mentoring. Why recruitment? Because if we can recruit people from diverse background, it already becomes bit a reflection of a society, and should I say bit empathetic towards the patient. It helps us to understand the patient because of our diverse employees. Workforce diversity is what we are looking into. We are bringing different perspective, improving communication and comfortable environment. So cultural assessment of patient. What do you think caused your problem? You can ask the patient. What do you think it started when it did? Why do you think it started and when it did? What does your sickness do to you? How severe is your sickness? What problem has your sickness caused to you? What do you fear about your sickness? What are the results that you expect to receive as on when on basis? Next is our internal motivations and self-awareness. Recognize biasness. Management decision influences by race and ethnicity. Physician less likely to recommend catheterizations for black females. Male physician prescribe more analgesic for white patients versus black. You need to answer such questions time and again. What provider behavior contributed to such disparities? What are the consequences of patients' experiences of biasness in the healthcare setting? So, what provider contributed to disparities? This is where you need to understand. As in, the provider, the medical practitioner doesn't have any perceptions of symptom. Provider perception of symptoms might be completely different. Provider perceptions of worthiness of patient is again needs to be understood. Whether what kind of classification that the patient has been marked with. Remember, a patient would always say that there he or she is in always a critical and a severity position. The provider is the one who will say how elementary the severity is all about it. Provider misunderstanding of ratios and ethnic differences, poor communication skills, as the case might be. Consequences of patient experiences of biasness in healthcare hold negative assumptions about provider, interpret provider behavior from baseline of mistrust. In fact, everything that the provider says he takes with a pinch of salt. Withhold information, important information. The provider does not divulge everything. Delays presentations of the for care and do not follow the recommendation. This is what the patient experiences the biasness. Whatever has been stated to them, whatever healthcare needs to be taken, interventions to be adopted, they don't do it, they don't follow it. They withhold the most important information. Let's say they have a particular habit, let's say smoking, and they don't confide it to the provider that they smoke. And this only magnifies the problem altogether. There might be patient who say they are already taking medicines of other diseases, of other ailment that they are suffering, which they don't disclose. Again, this might complicate the matter altogether. So we need to understand the biasness of the provider, biasness of the patient experiences. There are valid, solid grounds to it. With this, I come to an end of this video. Thank you for watching it.